we care about them? How much are we satisfied with them? And how much are we aware about what kind of problems they should be having? So I would like to tell you about the story of Nisha. When Nisha was born, the first point of contact, the first moment of amazing emotions between her and her mother were when she first time nurtured milk of her mother beautifully. When she grew up a little, she stepped into teenagehood. Her breasts also started developing, and that is when she realized she's actually stepping into womanhood now. And she grew up a little more. She fell in love, and her breasts made her feel what is sensuality, what is sexuality. And when she had her own daughter, again the first moment of beautiful emotion and touch with her daughter were when she fed her milk. She nurtured her milk to her daughter for the very first time. But then she found a lump in her breast, and that was pretty painless. So she ignored it. She said, okay, it might be fine because the lump is painless. But eventually, when she went to a doctor and got other checks done, the doctor said that you should go for further tests, and it came out that she's suffering from breast cancer. And now, because it is in the later stage, she will have to undergo mastectomy, which means one of her breasts would be removed. The experience is traumatic. Breast being one of the most feminine parts of a woman's body, losing it is a huge traumatic experience. As quoted by some of the breast cancer survivors themselves, losing a breast is worse than having cancer. In India, do you know number of breast cancer patients and survivors we have right now is more than the population of Bhutan? Yes, this is how big the problem is, and this new cases are growing at the rate of 13% every year. Where in US, around 70% of breast cancer patients are detected at an early stage, at stage 1 or stage 2. On contrary, in India, we have 80% of women have to undergo mastectomy. Why? Because those 70% cases are actually detected in the later stage, and there is sometimes no choice but to go for a mastectomy for the patients. And this is a miserable situation. Why? Because if breast cancer is detected early, at an earlier stage, it is so much curable. It is so much curable. And what you need to do to find it early, to catch it early, the first step starts with yourself. The first step starts with you identifying the symptoms of breast cancer. So for this, we actually conducted a campaign that focused upon behavioral change, that was nudging women. Its aim was to nudge women to perform breast self-examination. And by using behavior change cards, by using behavior change tools, we could actually go from a 7% women who were practicing breast self-exam regularly, and the increase was 400% to that number. So in just 2 months, women were actually performing 35% of women who are actually performing breast self-exam regularly. And this is after an intervention. Within just 2 months, this is the kind of results we could see. So I would like to tell you a little bit about what are the early symptoms of breast cancer. So this is one of the behavior change cards that we have developed. So the first symptom is a lump in your breast. Lump which is painless. But even if it pains, it does not mean that it is to be ignored. You need to consult your gynecologist, you need to consult your doctor. And again, a lump may not be seen, but it can be felt as well. The next is change in skin or texture of your skin around your breast or around your areola area. The next is the change in appearance of your nipples, if they get inverted inside or there is some kind of change. Next symptom is blood coming out of your nipples. Yes, and that does not mean that if once the blood comes, you can ignore it. No, it does not mean that the blood needs to come constantly. It can be once or twice. It's a very strong signal or that something is wrong. So please consult your gynecologist. And if you have an unusual rash crusting, or there's a puckering, say an inward kind of lump, or the skin is going inwards, then also it's not a usual sign for a breast. And in addition to that, having any of these symptoms, it's very important to know that this does not mean that you will have breast cancer if you have any of the symptoms. It's just that you might, and just to verify upon the facts, just to verify upon the condition, you need to consult your gynecologist, you need to consult your doctor, you need to consult medical professional, you need to get your checkup done. So what about women who already have breast cancer? What are we doing for them? For them, we are providing them both with the affordable products, as well as we are also helping them work upon their mental health. So this is the fabric-based breast prosthesis that we have developed. This actually comes in various shapes, various sizes. It's very comfortable to wear. It has some weight, as well as it comes in the lighter option. And it's pretty amazing actually. And it is just 20% of the cost of the silicone-based alternatives, the imported alternatives available in India. Our products are made as per the Indian consumer's need, as per the Indian woman's need. In addition to that, we are also making special lingerie items for breast cancer survivors and breast cancer patients. Apart from that, we are actively working upon mental health of both breast cancer patients as well as survivors, and other cancer patients and survivors as well. We are conducting online sessions by bringing in experts like doctors, mental health experts, body image experts, and so on and so forth. All kind of experts come together in an event, in an online event, where that's absolutely for free of cost for everyone whosoever wants to attend it, be it cancer patient, cancer survivor, a caregiver, doctor, social worker, anyone, and they can attend the session. And again, the sessions have been designed with the basis of the research that we did upon mental health issues that cancer patients and survivors face during the entire time of their treatment as well as post-treatment. And these sessions are extremely simple. They are delivered in the simplest language with all the practical insights. In addition to that, we are also looking forward to all kind of NGO collaborations, all kind of CSR collaborations for our awareness initiatives, for our mental health initiatives, and definitely for all the hospitals, all the beautiful doctors that can help us to ensure that we reach out to more patients, to more survivors, and help them out. So thank you so much. Warm regards from CanFem. Stay safe, stay healthy.